Tony Phillips, and I came to Atlanta Human Performance Center after having a total knee replacement surgery for rehabilitation and physical therapy. This is actually the second time I've been to Atlanta Human Performance Center for treatment. Approximately 5 years ago, I had an issue with my shoulder. Didn't have surgery at that time, but my orthopedic doctor recommended that rehabilitation and physical therapy would correct the issue. At the time, I couldn't reach behind me and get my wallet out of my back pocket because I had so much range of motion was restricted in my shoulder, a lot of pain. Came here for treatment at that time, and today I can reach behind my back with no problem. I have no discomfort in my shoulders. Having had that experience, when I then had to have surgery recently, this was naturally the first place I chose to come, and it's been an absolutely positive experience since the time I walked in. Pre-surgery, I had compromised flexibility in my left knee, a lot of pain and discomfort. I was unable to go up and down stairs, had difficulty standing for any length of time, which led me to see my orthopedic surgeon. After examining my knee, he recommended a total knee replacement, had that procedure done, and afterwards came here to Atlanta Human Performance Center for my physical therapy and rehabilitation. When I first arrived, I was on a walker. Couldn't put any weight on my left leg that I had had the surgery on. I had significant swelling all the way from my upper thigh, my quad muscles, through the joint itself, all the way down my calf to my ankle. Everything was very sore to the touch. I had a lot of bruising. I had lost about a week of physical therapy due to some post-operative complications. So I was a little behind schedule when I arrived. After approximately 3.5 weeks of intensive physical therapy with Dr. Evans, my progress has been significant and consistent. I am now able to walk unassisted. In the last week, I've been cleared by both my surgeon and Dr. Evans to begin driving again. Previously, post-surgery, I could not bend my knee. I think initially I was at about 54 degrees. Today, I'm at about 98 degrees. I'm able to bend my knee significantly beyond what I thought was even possible in about 3.5, 4 weeks. The rehab is challenging, but my experience has been that Dr. Evans is very experienced and knowledgeable. One of the reasons I chose to come here, I had a complication after surgery where I had to have what's called a manipulation. That was done about 2 weeks after my initial surgery. It was done on a Friday, and the business is normally closed on Saturdays and Sundays. But because Dr. Evans knew I needed to keep my knee moving immediately afterwards, he came in on both a Saturday and a Sunday. It was just the two of us here. The business wasn't open, but because he cared enough about me as a patient, he gave up his entire weekend to come in both on Saturday and Sunday and work with me. And I just don't think you'll get that type of care anywhere else. It's the reason I chose to come here. That shows a level of dedication and care for patients that, in all honesty, isn't common these days. One of the things that I'm really looking forward to, and I think I'm getting closer day by day, is where I live. I live very close to one of the parks in our city. It's in walking distance from my front door, and on a pretty regular basis, me and my 4 teenage kids would walk up to the park. There's a walking track and some other things, and it was our way of kind of bonding and kind of getting outside, getting some fresh air, particularly once the coronavirus pandemic started and everything was closed. We'd walk up to the park, and it was a family time that I really enjoyed spending with my kids. Well, since I've had this surgery, I've been unable to do that, so I'm really looking forward to being able to walk up to the park again and spend that time with my kids and get a little exercise in the process and some fresh air. And so it's not too far away. I think I'll be able to do that really soon. And that's one of the things that I'm looking for. I would recommend Atlanta Human Performance Center, and I have, to anyone that needs any type of physical therapy. Dr. Evans, I believe, is one of the best in his profession in the entire city. He is a doctor of physical therapy, which is a level of expertise beyond a normal physical therapist. And he's had this practice for nearly 30 years. So he's seen just about everything you can think of. That plus his experience and his training, I just think he's one of the best in his field. And he has a staff that reflects that. And so I would strongly recommend Atlanta Human Performance Center for any type of physical therapy or rehabilitation needs. The facility is well equipped. He's got all the state-of-the-art equipment, a gym facility that's adjacent to the physical therapy portion of the business. And so it's a full range of rehabilitation here. That coupled with the expertise and the experience of the staff, it's a first-class place to come, and they have a level of care that you won't find anywhere.
Mr. Phillips has made excellent progress, coupled with his dedication, daily workout, and his tolerance of the discomfort level that we had to endure because of a couple of complications he had with this total knee joint. At this point, he's progressed excellently with exemplary type of dedication and effort, but combined with an excellent surgery and an excellent follow-up surgical procedure that his orthopedic performed. His strength, balance, and range of motion have all improved. Functionally, he's getting back to where he was pre-surgery, but we want to get him back to where he was pre-knee pain. And so that's what our next goal is. We've decreased inflammation and pain. We've increased the range of motion. We're increasing the strength and in the range of motion. And now we're going to get him back into activity level, which requires him to have good range and good strength to do cardiovascular fitness training and full body training to get him back into an athletic type of atmosphere. He's done excellently, and I commend him on his work ethic and dedication to getting back to better than he was before his surgery.
And a really good doctor of physical therapy.
Thank you.